The Progressive Health Forum's Dr. Aslam Dasoo joins us for more on this. Dr. Dasoo, good afternoon to you. So the figure is actually 784 million rand budgeted, announced in the budget speech last year to treat cancer patients. As I understand it, that money hasn't been spent at all. How do you feel about this?
Good afternoon, Stephen. Thank you for inviting me. I feel as bad as all of those activists who were on that march today. PHF is strongly in support of the Cancer Alliance on this issue. And you know, for me, it's the negligence and the utter lack of care, of the duty of care that is exercised by this government with regard to healthcare. You and I both know cancer is of such a serious nature and it is progressive. And the more you delay intervention, the higher the chance of reaching a point of irrecoverability and palliation and death, when in fact your intervention in a timely manner can completely alter the course of a person's life. Now, with the huge backlogs, and I don't know if you've read the memorandum that the Cancer Alliance handed over, 2,000 people on a backlog at 2020, that has grown. The breakdown of Johannesburg Hospital's services following the fire was also protracted. The rehabilitation of it was hugely protracted. So the number is huge. There are only 2 facilities in Gauteng in the public sector that actually provide, say, radiation services. That's Charlotte Macleke here in Joburg and Steve Biko Academic out in Tshwane. And one is practically dysfunctional at the moment. So the problem is a mounting crisis. This money that was set aside after much lobbying by the organizations was meant to outsource the treatment, to service providers, private, who could do it and paid for by the government. And this was actually a progressive step. However, the fact that not a cent has been spent since it was allocated in March of last year because of what they say are contending priorities, I can't understand. You know, and I know, that if you don't repair your roads, they will decay, you'll get a pothole or 2 or more down the line. If you don't provide educational facilities, the impact on children is felt down the line. When you do not provide healthcare services that you have been providing, if you cut budgets to those services, the impact is immediate. People die. And that's nothing that you can simply turn away from. There's a culpability that you now hold if those services were in part of your responsibility. And I think they are quite right to demand action and for the populace to understand that they are being poorly served here by a Department of Health completely out to lunch.
The department seems to be saying that it would be better to spend the money on upgrading its own facilities. That's sort of the idea, or maintaining them. Do you believe that will happen? And I mean, as part of this, you speak to how long the delays were to get the emergency department at Charlotte Macleke up and running again. It's the real problems that the Gauteng Health Department seems to have, along with other government departments, and just spending money.
Yes, that is a problem. It's a deficiency there. But it's the response that really frustrates. It's a deflection. Oh, we'd rather upgrade our services. They've had decades to do that. All they have done is allow services to degrade. In fact, after the first decade of democracy, during which time the public service was properly integrated, we realized we had a world-class asset, widely distributed, the most widely distributed on the continent, with a full range of services from primary to quaternary care. 20 years of damage and misadministration, maladministration, misspending, and corruption have left us with a system practically on its last legs. When that system is assailed by further events like the fire at Charlotte or the lack of water, say to Helen Joseph and Rahima Musa, the impact is immediate and it's quite devastating. If you had walked into Rahima Musa or Helen Joseph Hospital after the Charlotte fire when all the patients were moved there, it was walking into a medieval horror. And that's because there's no capacity left. There's no reserve capacity they've built. When water ran out, it took an NGO, after a month of prevarication, in 2 days to drill 2 boreholes and water was provided. They couldn't even do that. So I don't think the health system is in the proper custody of those who are able to manage it. And in an election year, that's important. People need to think about that. This Gauteng Department of Health is a threat to the health care of population in Gauteng, certainly. I'm sure it's also replicated in other provinces. But right here, this is the most complex, comprehensive set of healthcare institutions you'll find anywhere. And it's in the care of people who don't even understand what they do. And that you will ask any health professional in any of the hospitals to verify.
Dr. Dasoo, in many ways, I've often felt that the most important MEC in the country probably is the Gauteng Health MEC, simply because of the way Southern Africa works. People come from across the country and from other countries to be treated in Gauteng. And it's a huge department. We've had problem after problem after problem. Some of the stories are just too traumatic, frankly, to go into here. We have a situation here where, thousands of people could lose their lives just because of inaction. Never really understood why government, over, I suppose, 30 years, has not been able to fix the problem of the Gauteng Health Department. It is a big, as you say, it's a big, complex system that needs to be managed. But surely it can be managed.
Of course it can be managed. And your lament is one that besets all of us, about the incapability to do even the essential, the elementary stuff. And you're right, they have a huge department. In fact, the department has grown dramatically with administrative staff and clerks, while also removing all authority from health professionals at the service delivery platform who are trained to optimize it. So they have no authority to manage it. It's managed remotely by people who don't know what to do. And it causes a great deal of frustration. They say pandemics reveal. Well, COVID revealed the deficiencies here, and the lie that lockdown would allow the government to up its capabilities and resource the healthcare facilities to meet the waves of infection were a lie. The health professionals got us through it, losing 3,000 of their own in that process to COVID. And that was because they didn't have PPE. The money was stolen for adequate PPE. They were not properly provisioned, but they went above and beyond the call of duty, and they got us through COVID. So the government can't even rely on that. They saw the deficiencies and they have done nothing further about it. So this tells you something, that there's a capability issue, there's a lack of care. The duty of care is absolute on the government, especially when it comes to health services, like it is for the health professionals themselves. But they, of course, are at complete variance with that. When you have an MEC that decides that because doctors haven't signed a form at Chris Hani Barra, it's a declaration of income, because they like watching that to make sure that doctors' lifestyles are not out of keeping with what they expect, while they don't do it, of course. But because the doctors have already declared and they're busy and they didn't, she demanded of the CEO to send all of those doctors to her office over 2 hours, some 800 of them, leave work, go to her office and sign in front of her. You are dealing here with megalomania. You are dealing here with politicians who don't understand how to run the system and who don't understand that they don't understand. In fact, they should not be involved in the provision of services. They have a department with, and one would hope, with properly skilled individuals to run that. But there's none of that. It's about the money. And the money is up to 40% of the health budget. 40%. So before they talk of NHI or anything, just remember 40% of the current health budget is misspent or it's stolen. Now, you want services on 60% of the budget in a province that's growing, and as you mentioned, people from all over the region arrive here, so there's huge pressure on the system, and you haven't even upgraded your services for 30 years. Those hospitals, like Rahima Musa, was the old Coronation Hospital. They put a lick of paint and a new sign that's decaying already. And they've done no other infrastructural adjustment to it. And we wonder why the services are so poor. They don't care, Stephen. They don't care.
Dr. Aslam Dasoo from the Progressive Health Forum, thank you very much indeed. Very sobering, of course, very sobering take on the situation in the Gauteng Health Department.